Good afternoon, everyone. Welcome to another Facebook Live. We've just had a downpour. Still got a few drips that are happening. So I hope we've had some electricity upsets. We've had some internet upsets. So I hope that it lasts for the next 20 minutes. And if it doesn't and I can't log on again, then we'll just have to reschedule. So it's great to be with you again. And for the month of February, in our practice newsletter, we are looking at the underwater treadmill as a treatment modality. And so it made sense for me to just spend a little bit more time and give you maybe a little bit more information about this wonderful piece of equipment. It's certainly, I got my first treadmill in Benoni in 2014. And it completely revolutionized my practice. It just simply gave me another really useful modality. But the underwater treadmill is not the be-all and end-all of veterinary physiotherapy or physical rehabilitation. And it really does take a specific understanding of both the treadmill, the properties of water, and also the goals of your therapy for a particular patient, to be able to use the underwater treadmill well. And the unfortunate thing is that I think that if you put an injured dog or a dog that's had surgery on the knee or the hip, or the dog that has a hip problem, or even a spinal dog, hi Yanni, nice to see you, then and you put them in the underwater treadmill, even with little to no knowledge, I would suspect that about 60% of those dogs would improve. And therein lies the problem. The problem is that the underwater treadmill is being viewed by many, and many in the veterinary professional circle, as being the be-all and end-all of physical rehabilitation. My question to you would be, what happens to the 40% that don't improve? And if you don't have a qualified therapist or someone with a background in treating these dogs and cats, and that your dog happens to fall into one of those 40%, then what are you going to do? Anyway, I am a little bit on my soapbox, so I will climb off, and I will try to explain some of the parameters that I use to make my decision in terms of the dogs that I place in the underwater treadmill. And primarily, I have a lot of factors that assist me in making a decision. First of all, for those of you that have actually been to see me, you will know that I spend a lot of time asking you lots of questions about not only about what's happened to your dog and what the diagnosis is, and I liaise with the vets, but I also want to know what's your lifestyle, what's the dog's personality, and the breed of dog plays a role. What do you want to do with your dog? All of these questions have bearing on the decision that I make. And then, depending on what I physically find on your dog and what my goals of treatment are for your particular individual animal, I will go to, okay, so what am I going to use, and what combination of pieces of equipment or modalities am I going to choose? So when we look at the underwater treadmill, the properties of water, and I've been through them in many newsletters, and I've discussed them on previous Facebook Lives, and I'm just going to highlight those which I think I need to be aware of, and also then to use them in conjunction with the characteristics of the treadmill. Okay, so first of all, we want to look at the property of buoyancy. So buoyancy is that property of water that allows us to float a little and to feel lighter in the water. We're more buoyant, and therefore our joints and our limbs and our body is actually carrying less weight. And as a result of that, because we're being supported by the water, as a result of that, the impact and the concussion on damaged joints is considerably decreased depending on the depth of the water. And so if the water is at the hip bone, then the dog is bearing 38% of its body weight, as opposed to 100% of its body weight on a land treadmill, as opposed to 0% of its body weight in a swimming pool. Okay, and as the water depth drops, so the support of the water decreases. So by the time we're sitting at the tarsal joint or the wrist, then the dog is literally walking or carrying 92% of its body weight. I stand under correction, but it's in the 90s. And so how much weight can your dog carry? What is the level of the injury? How much does it require the support of the water to move? And in the case of dogs with a neurological problem, or where they've had a back up and they can't walk properly, we need the water to support those dogs, to help a lot of them to stay upright. Okay, so the very big advantage of the treadmill is that it's a very controlled environment. And so dogs that are a little bit fearful and dogs that are not accustomed to being in water, we can control the introduction. We can control the rate at which the water comes into the treadmill. We can stop and start the water flow. We can ask the dogs to move in 2 centimeters of water initially if they're a bit anxious, and maybe that's where we stop. So we are also well versed in trying to make it comfortable and reading calming signals and behavioral changes in our patients and levels of anxiety. The other thing is that the treadmill is a tank. It's a contained unit, and that increases the safety factor and the movement factor. If I simply take a dog into a swimming pool and it's a fairly large area and it's a fairly large pool, my control over my patient is a lot less than in an underwater treadmill. So it has many uses, but it is not always the correct treatment of choice. So, for example, if a dog has a particular compensatory pattern, and I see this a lot with the older dogs where they've got lots of joints that are arthritic, we do want the water to support them so that those joints are not carrying too much weight. But if we walk those dogs in the water, on the treadmill, a lot of the time all we are doing is perpetuating that compensatory pattern in the treadmill. Far better, if possible, to take that older dog and breed aside cardiovascular, fitness, and any other medical conditions. I'm a vet. Those are all taken into consideration because there are certain factors which are contraindicated for the swimming pool because of the high cardiovascular load that is placed on these animals. But let's say that we have an older dog with multiple joints of arthritis. The heart is good. It doesn't have another medical problem. It's a golden retriever, so it loves water. That dog would be far better placed in a swimming pool, because in the pool, number one, it has no weight bearing. Number two, swimming is a completely different movement to walking. And therefore, all of those compensations and stiffness, areas of stiffness that the dog has developed because on land it's painful, we can successfully counteract in the swimming pool and not in an underwater treadmill. Now, if you haven't had any training, if there is a physical therapist that hasn't had any training in the different modalities of hydrotherapy, it could be easy to choose the underwater treadmill, and it may not be the appropriate therapy or modality for that particular patient. So buoyancy was one characteristic that I was looking at. The other is resistance. So we all know, anybody who's walked in water will know that the water creates resistance. How much resistance do we want for your dog? What's the problem? If the dog is very weak, is it able to even resist the water? Maybe we have to do balance exercises over a peanut first to enhance strengthening before the dog is even able to move in the water. Okay, so like I say, the treadmill is not the be-all and end-all. The other thing is, surface tension. As we drop the water level and the leg has to come out of the water, it takes more energy to bring that leg out of the water than to keep the leg in the water. And the joints will move in a different way depending on where the water level is in relation to the joint. So do we want more flexion, so more bend in the joint, or do we want more extension in the joint? So these are all choices that, as trained professionals, we can bring into our decision-making process and decide, should we be using the underwater treadmill or not? The other, so those are the properties of water, and only some of them. We didn't even talk about hydrostatic pressure or temperature. I mean, it's warm water for us. But then we also want to use the properties of the treadmill to assist with the results or the goals that we're trying to achieve for your dog or for the patient. So the treadmills that I have purchased, the tread has an ability to, first of all, we set the speed. So we can be very particular about how fast or how slow we want one of our patients to move. And also we can adjust it according to the size of the dog. Smaller dogs, by virtue of the fact that they are smaller, many of them want to move faster, but actually, therapeutically, they need a slower speed than a large breed dog. This we can do, and we can adjust the treadmill. So it's very, very useful. It's not as though, and they come in very, very small adjustable increments. It's not like some of the early land treadmills where you could go 1 kilometer an hour, 1.5 kilometers an hour, and 2 kilometers an hour. I mean, the new ones are a bit more sophisticated, and some of you may be so young that you've never been exposed to a treadmill like that. But the underwater treadmill, we are able to adjust the speed in very, very tiny increments. And so we can look at, are we getting the weight bearing we want? Are we getting the movement we want? Is the dog actually engaging the leg or the body in the way that we choose? So that property in the treadmill is very useful. The second aspect is that the treadmill, for those of you that haven't seen one, is really a tank. It's a tank with a tread at the bottom, and it has doors that open and close, and so we walk the dog into the tread with no water in the apparatus. We close the doors, and we have an introductory phase, but we close the doors, and then we gently, slowly let the water in. It's very controlled. Our dogs always have some form of restraint on them, a harness, a life jacket, something so that, and there's a therapist in the treadmill with them, so that we are limiting panic and we are restricting the chance that some giant dog might decide to jump out, or some little dog might become so anxious that they throw themselves against the wall. So, it is a very contained and controlled space, and that in the right hands makes it very safe for the dogs. And incidentally, all the treadmills actually have emergency release, emergency empty, emergency water dump. So if we end up in an emergency situation, we are able to override the whole system and dump 1,000 liters of water if that's what's in the tank. Okay, so it's very safe. And then the last aspect of the treadmill that is hugely useful is that the treadmills that we use at Animal Health and Hydro, we are able to set them either on an incline or on a decline. And depending on what we want to achieve, we will choose a level, an incline, or a decline. And so it adds another dimension in terms of how effective we can be and how well we can target the areas that we're specifically looking for. So remember the level of the water as well. If we want to target a wrist joint, then one of the places we're going to move the water to is quite low down if the dog is able to, because now we want to change the range of motion of that joint while the dog is walking. Okay, coupled with the speed, coupled with an incline or a decline. And so we have a really wide variety of characteristics in both the water and in the treadmill that can make our treatment very specific. But we have to know what we're doing, and we don't want to make it worse for the dogs that we treat. Water itself, like I said, is such a good modality that 60% of the dogs, I think, are going to get better anyway. Even if you just walk them at the hip level, they will improve, because water is magic. Anyway, so those are the properties and why the underwater treadmill is such a useful treatment modality. And in closing, I really just want to spend a few minutes on when we would not use the treadmill. Okay, so I did speak about, for example, if a dog has a specific gait pattern or a specific compensatory pattern, a way in which it's holding its body. When we walk the dog, even in the water, that pattern may remain. And when we're doing therapy, we often don't want that pattern to stay. We want to break the pattern. We want to give the dog an opportunity to change and to return back to a more normal way of carrying its body. So in those instances, we may choose to not use a treadmill. The other areas are, for example, what if we've got a dog that really is petrified? Okay, water might not even be the treatment modality of choice. We may not actually even choose the underwater treadmill or the pool at all. We may choose to use inflatable equipment, balance, other physical property, pieces of equipment that will give us a similar result. We just don't have the support of the water then. So that's why I spend a lot of time asking questions. And then, some dogs are claustrophobic. I have had a few where by placing them in the tank, you can see, even before we put any water in, you can see that the dogs become fearful. And so it may not be appropriate for those dogs. Some dogs really struggle to understand how the ground is moving beneath them. Okay, so we might introduce them fairly well and they might be okay with the water and they may move up and down in the treadmill, and then the moment we face them in the direction that they need to face for us to start the tread to move, the moment that tread starts to move, the dog may freak out. So we have ways to overcome those behaviors, but there are also times where it's not appropriate to push. And therein that comes with our dog handling abilities, our experience in terms of working with dogs, and our veterinary experience. And then a few others, for example, if we've got a joint that has been fused, whether it's been a surgical fusion or whether it's been because there's extra bony growth or there was an injury or something like that, then we also have to use the treadmill with caution. We also have to use swimming with caution. And so we'll pick that up in the initial assessment, and then we'll choose a treatment modality that we think is appropriate. And then the last patient where I am not keen to put the dogs in the treadmill are dogs that have had a limb amputation. They are compromised already. They have 3 legs, and to ask them, so then they already have a compromised gait pattern and a lot of muscular tightening and shortening and a lot of changes. And then we want to ask them to move those 3 legs through in an abnormal gait pattern through water. So I personally, it's a personal choice, do not like to put amputees in the underwater treadmill. I prefer to swim them, and I have a lot of reasons for that, which if you happen to be someone who has a dog that's had an amputation, I will discuss with you at length if you ever make that appointment. Eileen, can you just give me a little bit more info, please, about if I was to put shoes on the paws. I'm sorry, I don't understand the statement. To achieve what? Can you give me a bit more info? Thanks, Eileen. Okay, so yeah, thanks, Angela. Your dogs love the treadmill. They do indeed, especially when there's little piggy wiggies that help them. I just want to run through. Cool. Thank you for the compliments. Hi, Colleen. And yeah, I just want to see if Eileen put something online. I think maybe shoes to assist them with the moving tread. Shoes can, little sticky paws and things may actually throw them off balance. Okay, to offer security. They may throw them off balance if the dog is not accustomed to having shoes or boots on. But what we do explain once the dogs are fairly are okay is, okay, we're trying to achieve this, therefore we're going to try with a set of shoes or a set of something else. From a security perspective, I find that dogs that are anxious, if we place them in a float coat or a life jacket, in many of those dogs that acts almost like a thunder shirt. So a thunder shirt, the idea is that it's snug around the dog and gives them a feeling of safety and security, a bit like being back in the womb. And so I do find that with some highly strung dogs, some rescue dogs where they're a bit uncertain, and some anxious dogs, if we place them in a float coat and we tighten those straps, not too tight, they need to be able to breathe, that will often give them a feeling of safety and security. So cool. So our time is up, and I hope I've answered everybody's questions. I hope that just gives you some insight into the underwater treadmill as a treatment modality. And thank you very much for joining me. And I shall see hopefully a lot of you again next week, Thursday at 5:30. Have a wonderful evening. Thanks, everyone.